and welcome to The Practice Pulse, the podcast dedicated to helping owners of private medical and wellness practices scale their revenue and patient lifetime value using smart systems and proven growth strategies. I'm your host, Nancy Margaret. Having worked to scale a business in the wellness industry, I understand the future of practice growth lies in leveraging data and systems, both for patient care and also for business operations. We're here to share the real-world insights that allow expert practitioners to focus on patient care while their businesses grow on autopilot. Today, I'm honored to welcome Jim Kaput, Chief Scientific Officer at Vydiant Incorporated. Vydiant is at the forefront of using advanced technology to assess holistic health and lifestyle data for disease management and overall wellness. We're going to discuss Jim's journey with Vydiant, their key wins, and what they are seeing succeed in the private practice space. Welcome to the show, Jim.
Hi, thank you for having me, Nancy.
Yeah. If you don't mind starting off, could you give us just a little bit background about yourself and Vydiant?
Sure. So I'm somewhat of an unusual scientist in that I have been in multiple sectors. So I started, as most of us do, in academia and spent many years there. And then I was the director of the biotech lab at Northwestern University. But then right around the end of the 90s, I started, either joined or started my own biotech companies, focus on the same things I'm doing now, which is nutrition and genetics or environment and genetics. Fast forward a few years, and the FDA hired me as the director of the Division of Personalized Nutrition and Medicine at the National Center for Tox Research. That's a mouthful, I know, but essentially, this was the only center in the FDA that does not regulate a product. What it does is regulatory science. So that's where I was for 3.5 years. I'd probably still be there, except that Nestle announced in 2010 that they were going to put $500 million into health research. And as you know, most of us around the world, all the scientists do disease research. We want to try to stop a disease or study it. But there are very few programs that actually want to look at health, which has always been my interest. How do we prevent people from developing a disease rather than try to fix it after it happens? So I went to Switzerland, was there for 5.5 years, a very productive time in my career, both the FDA and the Nestle time. But then what I noticed is that regardless of all the work that we do as academic or government or industry scientists, it's really hard to translate your science or all science, relevant science, into reality. And so what Vydiant is trying to do or is doing is taking the wealth of knowledge that we have accumulated in the scientific corpus or community, get the critical features of that science, and then apply that or translate that into the real world. So that's what we're trying to do at Vydiant. And we can go into all the details, but that in a nutshell is my journey to Vydiant and then what we're trying to do at Vydiant.
Okay, awesome. I think that's a great starting point because my first question kind of dives a little more into that. So, as Chief Scientific Officer, can you explain the core problem that Vydiant was founded to solve and how your platform uses data and technology to assess holistic health and lifestyles for disease management?
Right. The big problem is that the overarching problem is that a disease like diabetes, coronary artery disease, most of our chronic diseases have a huge lifestyle impact. That is, lifestyle impacts those diseases. But when you go to the doctor and the healthcare system, no one asks you about your diet or physical activity or social activity. It's just not in our medical records. So there's a myth around, it is a myth that if you want to do precision medicine and you want to do just with genetics and what's in your electronic health record, and you ignore or omit to include all the lifestyle behaviors, then you're not going to be able to do precision health and precision medicine. So our mission is to fill that gap, which is to collect individual users' lifestyle behaviors. And we focused on nutrition, which is the hardest one to do, and we can dive into that one more. Physical activity, which now is easy because of watches and stuff.
Mm-hmm.
Social activity, which is not usually captured in the medical establishment, your ability to cope with stress, and then sleep patterns. That's right now what we're starting with. And the idea is that we are creating tools, unfortunately questionnaires, so that we could ask you what you eat, how you sleep, etc. And now sleep also is being done with watches, of course. But part of our mission is that we want to have an equitable distribution of our resources. We don't want it for the worried well who can afford a $300 watch with the physical activity monitors. We want to make sure that people who may not have access to those types of tools would also be able to get our information for us. So our first step is to collect that information. And what the hardest part about that is there are thousands of apps out there that collect your diet and physical. We're not going to compete there. So what we're trying to do are two things. One is we want to simplify how you tell us what you eat. And secondly, we want to integrate those questionnaires into your visit at the clinic so that it will, just like when you go into the clinic and they ask you, have you been exposed to COVID and have you been sick lately? How do you feel today? Those questionnaires, we would have another set of questionnaires at that point that the patient would fill out, and then that would go into the medical record so that both the physician and the patient could have an assessment of the patient's lifestyle. We have very, very simple scoring mechanisms to do that. We're making it easy by going to existing data. There's actually large amounts of data out there that we could use to create what we call personas. So somebody who is age 30, who is a African-American male, what do they normally eat? So we prompt the individual with that information because most of us don't think about our normal patterns in life as something that we consider. We don't have mindful living. So by asking the question, but also prompting people like you eat this or this amount, et cetera, that helps the individual fill that question out. But it also prompts them to start thinking about their lifestyle so that when we ask a second or third, and then eventually every visit that you go to the doctor, you start thinking about your lifestyle. And that is actually the first step of behavior change, of knowing what you're doing before you can act. And the data that we use for that is available. It's publicly available gold standard data from NHANES, which is the National Health and Nutrition Examination Survey. There's data about how much activity, social activity you have from various government databases, et cetera. So we create these personas and present it. So that reduces the burden for the individual. The second thing we do is that we have a pipeline that extracts from scientific literature all of the lifestyle factors that have been studied and how they positively or negatively impact a chronic disease. And we have over 5,000 lifestyle factors. So there's 1,700 foods, 300 physical activities like running and jogging and bowling. There's social activities like visiting your family and friends. All of those have been studied with the idea of how they would affect a condition. So when the user tells us about their lifestyle and their condition or their health goal, we can give them guidance, not that we make up, but that is from peer-reviewed literature. So there are 44 million documents in the National Library of Medicine, which have all those lifestyle factors and conditions. So what we do is we extract the information, we weigh it, we score it, and then we present it as not as here's what you should do, but rather here's what's known about what you should do, and here's the strength of evidence. You can do or not do. That's up to you. But we want to give you more verified data or guidance than you can get from Dr. Google or Dr. Chat because they get it from everywhere. And so ours is reproducible and traceable. We have the ability to say, here's the guidance. If you really are skeptical about that, here's the link that you can go and look up the information. So it's a way to, essentially what Vydiant is doing is gathering all of the available health data that we know, putting it all in one place, and then providing it to the user or to the physician so that better health guidance can be obtained. The final thing I'll add before we go to the next question is we're also introducing genetics into this. So the idea was that when I was back in my own companies back in the early 2000s, we didn't do it, but there are companies even today that would test one gene out of the 20,000 that are usually made, proteins that are usually made in the body. And they would look at one variant of your total genome and say, well, you have that variant, eat more broccoli. Well, that is not biologically sound because all of our biology is a system, and it's interacting with multiple components and therefore multiple genes. So the genome-wide association studies of the past 20 years or so have created huge amounts of data But they too looked at each of the variants and whether they influence the disease one at a time. But now there's a new push, not only with Vydiant, but also in the academic and business communities, to combine the data from those genome-wide association studies into multiple genes, and they call it polygenic risk scores. So poly just means many genes.
Right.
And then we break it down one more step. That gives you your overall risk. The question is, why do you have that overall risk? And for that, what we do is to look at pathways based on genetics. It's a little I don't think it's too complicated. The idea is that we use available data again, this time genome data. We give you your overall risk. That's the polygenic risk score. And then we give you why you might have that risk because you have certain pathways that would be influenced, that would influence your likelihood of getting a disease. So now we have collecting the data from the individual, collecting genetic data, combining that, and then giving them peer-reviewed, evidence-based guidance to help them on their trajectory toward health.
That's awesome. I love all of that. I love it's amazing where we are in our society with, the advancement in AI and being able to take system like 20,000 genes and cross-check as it were to come up
Yeah,
with a plan like that. So I love that.
it's
Go
yeah,
ahead.
it's absolutely true. We had these, I mean, not just me, but the community had these ideas for many, many years. But these advances in AI and machine learning are clearly why we can do what we can do now, no doubt.
Right. That's awesome. So if someone wants to utilize this, how do they find you? Or do you find them? Is it through the practitioner? Can an individual reach out and say, I want to have this testing done? How does that work?
Right. So we're going to soft launch this in the Q1 of 2026. So we're still putting the
Okay.
pieces together. We got all of them together, but we have to make sure that, if we get 100 people asking, we want to make sure that we can give the data back in a reasonable information back in a reasonable amount of time. But we'll be announcing it on the usual LinkedIn, um, and then we're going to have an advertising campaign, of course. Our website will also be a site where people can go to. What we've decided, and I might as well bring this up now, is that because there are so many apps to measure lifestyle, we don't believe we can create an app that's a killer app on it. I mean, it's just unreasonable. There's too many. But what we can do is make all of our questionnaires and scoring freely available through our website and through what's called a progressive web application so that you can actually
Yeah,
do it on
a
your phone,
web-based
right?
app.
A web-based app. So we're going to just release that as a freemium and let people take the test. We have very easy ways of scoring. And what you do is you would take the questionnaire and then, a week later or 2 weeks later, if you want to change, you take it again and then you see how your scores change. And one of the reasons we want to do that is if people do want to know about their lifestyle, they get free information about it. We won't charge them. But then down the road, what we would obviously do is ask them if they want to buy that genetic test, because then it could give them more information about what they need to do to maintain their health. So that's essentially our first set of products that we're gonna release. We have another product that you can look at the database from the literature and look at all those associations. We have a network graph, a table, and we have what's called a strength of evidence graphs. But what we found is that even academics who are in the field of nutrition or physical activity don't seem to want that. They think it's easier to go to Dr. Google. I I I use it myself because I'm still a scientist, but I don't understand the reluctance because we have traceability. And normally when you go to a PubMed article, a search, you put in your search terms, even if you have good Boolean connections there, you look at the top 100, then you get tired because there are so many articles on it that you never do a comprehensive look. And our tool gives that comprehensive, we bring in every paper that's been published. We also have tools that are not yet commercially available that extract what's called Kiko. So from any study, it could tell the population what the intervention was, what the comparator was, and what the outcome was. And
Hmm.
that's important because you can do a study for, let's say, blueberry extract in a 60-year-old, The question is, would that result that you get from that study be the same as a 30-year-old female, right? So
Right.
you want to know the population. You want to know what the dose was. We get that from the intervention, et cetera. So we have that pipeline. And we have a third pipeline that can extract all the statistical values from the paper. So one of our corporate contracts that we had, we looked at over 100,000 papers and extracted the PICO plus the statistics so that they could then use that information to build their products. So the whole idea, I mean, that's all detail. The idea is we're a data company. There's huge amounts of good data out there, but we feel that very few companies are pulling it together in the way that will impact health or product development for health, products for health.
Right. Awesome. That's really interesting. So do you do any, or will you, as you kind of release things, will you do any direct marketing to like
Yeah,
practitioners, or like is this
yeah,
something, if you have specifically, because you, as you said, a lot of nutritional doctors are maybe a little bit reluctant, but you kind of, I feel like some of the holistic doctors that are shifting more to a
yeah.
lifestyle approach that maybe even started in the straight Western medicine, but are shifting to kind of more of a holistic approach, are more open to these things. Is that something that you're planning to kind of market to them as well?
Yes. So our first set of physicians that we want to start using this, and one of them, one of our consultants, is a primary care doc, a direct primary care, because those physicians usually spend more time with the individual and are more open to this idea that yes, medicine's important, but you have to think about it holistically. So yeah, that's our primary one that we're going to market to. We also, I'm a member of the American College of Lifestyle Medicine, which you may or may not have heard of. That's a board specialty now. And there are, I think their organization has something like 12 or 13,000 members spread out across the United States. Many of those, but not all, many of those are in traditional medical systems, right? So that even though we have a little struggle getting into traditional medicine, because it's usually, the doctor only has 10 or 15 minutes, it's usually drug oriented. There's this other set of doctors who are in their own practices or in large medical practices who believe in lifestyle medicine. So that's another one. I've been to one of their meetings. I'm going to go again in 2026. In fact, we'll be. I'm going to see if they'll let me present some stuff in 2026.
Okay, awesome. Let's see. We'll move to some of the practitioner stuff like we were talking about.
Right.
From your vantage point in data science, what is the single biggest operational or clinical trend that you see in the private practice space that is separating high growth practices from the rest?
Well, it's a tough one because I am not an expert in that. But what I see from the outside is that there's this consolidation, right?
Hmm.
Medical practices, both small and large, keep getting bought up into bigger conglomerates. And from what I understand, what happens is that usually doesn't go sit well with the physicians because they have to do more paperwork each time they do that happens. So I can't address that. I can say from my own vantage point, which is highly biased, is that our medical system can't keep going to treat people because it costs too much. And most economists will tell you that right now, as I understand it, healthcare costs are 18% of our GDP in the United
Hmm.
States. And they say it's going to go up to 22% in 2030, whatever the number, whatever the year is. The way to address that is not by dumping more money at it, but by helping people stay healthier longer. So that's our mission. Is our mission is to try to keep people healthier. So I'm highly biased, and I would hope that if we can get physicians to adopt these, to start thinking about lifestyle medicine, use our tools, that's a high growth potential because it would have to be because we can't afford it the other way. Now, I mean, I know, as I said 3 times already, I'm biased and I'm very optimistic. It's going to take a long time to change that culture. But one of the reasons it's going to take a long time is we don't make it easy. We make it really hard to do this stuff. People are busy. They don't want to think of themselves as scientists when they're cooking dinner or they're having friends over. So our mission and the mission of people in the preventive health area, how do you make it easy for people to understand what they're doing in their life and then How do you help them do it better so that they can stay healthy longer? So that's our mission. That's not something small, by the way.
No, it's huge. I worked for a supplement company, and that was part of what I did was build out a nutritional program and exercise program for people that
Really?
were looking to pursue better eating habits. So, but what I love about what you're doing, because I firmly believe that everyone's body is different. And so you should be eating different things based on your different body type, your gender, kind of the where you are in your hormone cycle in terms of age wise. And then also now you've pulled in this gene component, which I think takes it even to another level of expertise. So I love kind of what your focus is here. I think it's really great.
And all those factors you mentioned, I've had some experience, some publications in some of these. It is true. We do science by putting people into groups and then comparing the response of the groups. Our work that I've done with my collaborators in academia and in government and when I was at Nestle, tried to look at the individual. And we also published a couple papers involved in women's health. And you're absolutely right. You have different metabolism throughout the cycle. So all of that is to be done. Our view, or let's say my personal view, is I believe we can do that in real time if we build our systems the right way. Of course, we have to have people willing to share their lifestyle, share information like what's going on in their life. But if we can do that, we can do that better than any one study because no study can be comprehensive. It's just impossible. So you can't collect enough data or you have enough people in the study.
Right.
Okay.
Okay, so when Vydiant is looking to expand its reach, whether it's practitioners or individuals, what is the most like significant kind of bottleneck that you find in? I'm sure you've already started some pre-advertising, but in trying to find those like strategic partners with practitioners or even like groups of people, like what are some bottlenecks that you've found with that
Yeah.
system or that process?
Yeah, it's always the case that emails aren't answered. I mean, for example, on this, our program, our web app called One Health Pro, which interrogates the knowledge base. I must have sent 500 emails out, but people don't respond to emails. You're too busy. You don't believe, you don't trust the person. And so it's really a matter of how do you find the right marketing strategy? But what we've been successful with is by going to these big meetings like the American College of Lifestyle Medicine, and there's also the direct primary care physicians. They also have a conference. I haven't been to that yet, but that's on our radar for next year. I think we're preparing our not I won't say pilot, but the soft launch will give us the use cases that we need to talk to people and say, look, this is what's happening. This is how we do it. What I found throughout my career without all these ideas, which go back even 20, 30 years, is you can wave your hands and say, well, this is how it's supposed to work with nutrients and genes. But until you do the work and get results and show them a result, they don't believe the hand waving. So
Right.
that's our mission. We built all of our tool sets. Now it's how do we implement? And we're doing that through strategic partnerships. We're talking with a major medical school in the Wisconsin area that would look at, we would help them have people who have prediabetes to keep them healthy. So we're going to set up a study with them. And we're going to do that with a concierge clinic in Mexico. And so we will introduce it first by getting the information, by then doing this outreach to the target groups like American College of Lifestyle Medicine, direct primary care. And I think when we do it that way, it's going to be organic growth. It's going to take a while. But once it catches on, I think the curve is going to be, it's going to be the hockey stick curve that all the investors want to see.
Right, right. That's very cool. Yeah, I love the idea too of approaching concierge doctors. I was recently looking at one that has like a membership model, but it's definitely something that someone who's looking for kind of that premium that could be added into their
Yeah.
scope of their package.
Yeah, and that'll be one. And I also want to come back to what you said before. You worked at a supplement company. We believe supplement companies would be interested in this too, because
For sure.
I mean, to just give somebody a supplement without assessing their lifestyle, that's not quite right because you got to sort of know where they are. I know that I've seen some supplements get some information, but I don't think it's going to be the depth that we're going to get. So we would be very happy to talk with a supplement company that we want to make sure that they source their supplements the right way. As you know, there's a lot of controversy in that
For
field.
sure.
But if we do that, then we could help them do their work too. So we are interested in what we call health adjacent companies that could
Right.
use our tools as they do their work. Then we could help them with that.
I love that because I do feel like I take several supplements that I were recommended to me by a naturopath who did testing, blood tests and stuff like that. So in conjunction with my doctor. But I think it's really important for people to understand that the supplements that they're taking need to match what their actual needs are, not whatever the advertisement says it's going to do for them.
Yeah, that's
So
right.
I
That's
think
right.
it would be great to have a tool like this to sit and look at and say, okay, this is going to support your, your genome, your lifestyle if you're taking this specific supplement, and this is how it's going to support. So I think that would be a great connection with supplement companies. So looking forward, I know you're looking to launch soon, like within the
Yes.
next quarter. So what does it look like for the next 12 months? Like what are your biggest strategic goals for the next 12 months? How does that involve expanding your network? How does it involve, kind of expanding, like do you have specific goals in mind, specific amount of strategic partnerships you're wanting to get?
Well, again, what we believe that we have to get some of these use cases, real life use cases. That we're actually
Mhm.
using my DNA right now as the as the start. Which actually, when the results came back, it's pretty on target. So it's very interesting. But what we need more, we got to have it where we have some targeted doctors, and our network is going to allow that. The Mexican group that we're working with believe that they could sell, like up to 500 within the first 2 years, 500 tests for the genetics. And because their clients come from all over, we could use our other questionnaires reasonably well with that. And then this research study that we're going to do with the medical school, I think that's going to give us a lot of credence to go forward. So we don't have specific numbers yet, but we do have targeted companies, including electronic health record companies. So let me diverge a little bit there. The two
Sure.
biggest electronic health companies in the United States are Epic, which has about 37% of the market, and they actually are in Wisconsin here, right next door to Madison. And then the second company is Oracle Cerner, which has about 20% or so of the total medical record business. So that comes up to be about 60% of the market. But there's another 40% of the market of electronic health records, which cannot be covered by Epic and Cerner or Oracle because they're too expensive. So if you have a direct primary care physician, the Epics and Oracles of the world don't have a product that is priced that can go to that type of size clinic.
Hmm.
So we believe that we can go to there's like 10 to 15 electronic health records, which have varying levels of numbers of patients that they can handle in their software. So we're going to target. In fact, we've already have one company that has integrated our questionnaire into their electronic health record. So that dovetails very nicely with this direct primary care market because they would be wanting to get the electronic medical record software from a company that they can afford the product. And if we work with that company, then instead of going to each direct primary care physician, we sell it through the electronic medical record company, right? So that shortens our ability to really launch and grow fast because instead of going one to one, we go to that company and they help
Right.
us disseminate
To
our
the
tools.
to
Yeah,
the
to the
many.
bigger,
Yeah.
to the
Yeah.
many.
I love that. That's awesome. Okay, so typically on this podcast I am interviewing private practitioners. So different levels and different types. I wanted to interview you though specifically because I think you are a very good resource for private practitioners, and so this is kind of a resource tool for them. So with that in mind, based on the data you use, what is the single best piece of advice that you would give a private practitioner today in terms of, like, maybe has something to do with how to use how to
Mhm.
integrate what you're offering into their practice and how that could benefit them?
Yeah, well, I'm biased. I'll tell you that right away. I think the most important thing to do is capture quantitative or at least semi-quantitative lifestyle behaviors. right? So when I went to the doctor in 2006 or seven, might have somewhere around there, I had gained weight. And even though I exercised and I thought I had a good diet, I did. It turns out that I lost my thyroid there. She didn't pick up on that. But the first thing she said was, well, do you eat? How's your diet? I said, I have a very good diet. She goes, how about your activity? I'm very physically active. And she's okay, here's your drug, right? And that's not the way to do it, because just to say that I'm physically active, what does that really mean? You got to assess it and put a number on it. Now, there's no gold standard number, don't get me wrong. But what we're trying to say is, especially because we compare it to the population average, when somebody says, I do 30 minutes of activity per week, that's vigorous, then our tools can say, okay, that for your age group, that's about average, or that's below average, or that gives them some benchmark to work off. And it gives the doctor the benchmark. So I think the thing that I would ask the clinicians who are watching, first of all, if you're interested in all these things that I'm talking about, contact us. Secondly, even if you don't, try to get more assessments of the lifestyle, because whether you're old and you're living alone and you don't have social connections, that's a huge problem in the United States. That affects your life, right? If you're younger, but you're physically inactive and you think that walking to your car after work is physical activity, that's okay, but we want you to do it. You got to have it quantified some way, right? You got to say, yeah, that's okay, but we got to think about it. So what we're talking about, and it sounds over the top, but this is a cultural change in how we think about health, right? Don't wait till you get sick to get your pill. What are the small steps and behavior changes that you can have an active lifestyle and a healthy lifestyle? And that's not small, but we got to help people do it.
Right. Right.
I heard in Canada once. I went to a meeting many years ago, and this woman who was the head of the funding agency in Canada said, "We don't make it easy to be healthy. We have to make health an easy choice. So if you have that goal, then all the work that we're doing is toward that goal. How do we make health an easy choice?" And I think it starts with first assessing in a non-intrusive way. Secondly, giving guidance that is evidence based rather than what you hear from your sister's relative's cousin about what
Right.
supplement to take.
Yeah.
You got to have something there that makes sense. And I think it's going to be a slow process, but in my lectures and when I talk about this, I use Mothers Against Drunk Driving. Now, you're not old enough probably to remember this, but in the 80s, they would have very effective commercials about children who were killed because of a drunk driver. And they were very emotional commercials. What it did over time is it made it socially unacceptable to drive while drunk. Now we still have drunk drivers, right? There's a, but it's not it's fewer than what we had in the old days. And so somehow we have to come up with this message that we don't want you to change your life and not and think about everything you eat and run every day unless you want to. We just want you to know what you need to do to be healthy and start doing some of it. That's the idea. Slow
Yeah.
changes. Yeah.
I love that. Yeah. Doctors Against French Fries or something like that.
Well, we have French fries. I'm married to a clinical nutritionist, and we have French fries, but we don't have them every day. That's the thing.
Yeah. Well, there are slightly healthier ways. You can toss in some avocado oil and bake them and put
Sure.
rosemary and sea salt on them, and they can still be delicious.
Sounds like you're a cook. That
Oh
sounds like
yeah,
you're
I love to cook. I love food, and but I also try to eat in a relatively healthy way. You cook
yeah.
a lot to do that.
Yeah. I think and we do that, and I've been doing it for like 20 years. I don't go out as much as I used to when I was younger, especially when I had kids, right? Because you're going to soccer practice or
Right.
gymnastics or volleyball, and there's no time to eat. But I cook at home a lot, not elegant, but by
Right.
doing that, then you usually can control what you're eating better, right? You have a better idea of what you're eating.
100%. Well, cool. Jim, your work at Vydiant is truly showing us some of the future of data driven wellness. I love the stuff that you're doing with AI. I thank you so much for sharing your experience with us. I'm really excited to see what happens when you launch. For our listeners, you can find Jim and Vydiant at Vydiant.com. It's Vydiant.com, and I'll have it below in the comments on this as well.